There's a medical condition in America today that's affecting more people than HIV/AIDS, breast cancer, and diabetes combined. Despite this statistic, 87% of patients that are admitted to the emergency room with this condition are checked out within 24 hours. They're checked out without a plan. Now take a look around you in the room today. Look at the person to your left or to the person to your right. It's estimated that 1 in 14 people in America today, 1 in 14 people in this room will already have experienced a traumatic brain injury in their lifetimes. Now that equates to 22.2 million people in America alone. But what I'm about to tell you next is the most important number. Out of those 22.2 million people, 14.4 million of them are unidentified or undertreated cases of traumatic brain injury. So is it possible that the person to your left or the person to your right, or even that you or someone in your family will experience a traumatic brain injury? I think it is. So before I move any further, it's important for everyone in the room to understand, and everyone online to understand, what a traumatic brain injury is. Traumatic brain injuries are categorized based on their level of severity. They're broken down into 3 categories: mild, moderate, and severe. A mild traumatic brain injury occurs when loss of consciousness is very brief. For the period after the traumatic brain injury, there seems to be this time where you're dazed and confused, but this may only last minutes to hours. A mild traumatic brain injury is also known as a concussion, also whiplash. You could also be too close to an explosion and sustain a mild traumatic brain injury. Now, while this is the easiest, not easy, but the easiest of the 3 to overcome, it's important to realize that multiple traumatic brain injuries, or TBIs, over a lifetime could actually lead to things like dementia, major depression, and suicide. Second, you have moderate traumatic brain injuries. Moderate traumatic brain injuries occur when loss of consciousness can occur anywhere from minutes to hours. And in the periods after, there seems to be that period of dazed and confused that can last from weeks to months. And then lastly, you have severe traumatic brain injuries. These occur with a devastating blow to the head that affects your brain tissue. Most of the time, a severe traumatic brain injury is fatal, and when it's not, it's the most difficult to overcome. Okay, so now that we all know what traumatic brain injuries are, why am I here? Why am I speaking to you about it today? It all started for me back in December 2013, when a J&J employee wrote me an email and scheduled a meeting with me. At the time, all I knew was that the meeting was titled Traumatic Brain Injury for Veterans. Now, in addition to my day job, I also volunteer as the national co-chair for the Veterans Leadership Council here at J&J. The Veterans Leadership Council, or VLC, is an employee resource group that helps military veterans within the company, that helps military veterans in the community, and helps tie our J&J products to the veteran marketplace. So at this time, all I knew is that someone was coming to me with another idea on how we could help veterans. And I'm sitting in a meeting, I'm sitting in a conference hall waiting for this meeting to happen at World Headquarters in New Brunswick, New Jersey. And in walks this guy, and he has this huge smile on his face. He's so excited. I could tell right away that this guy has the most dynamic personality, probably that I've ever come across at J&J. I could tell right away that I like him. So we go through that phase of breaking the ice for about 20 minutes or so, or talk about sports or whatever else we talked about. And then he said, "Let me tell you my story." Now I'm going to try to tell his story today like he told it to me. It was 2010 when he was on his way to a sales meeting, driving down the New Jersey Turnpike and coming out of a toll booth when a dump truck sideswiped his car. Now the dump truck had direct impact to his driver's side door, leaving him with multiple spinal injuries and what he later found to be a traumatic brain injury. Now, I think he did what most of us would do next. He got better as quick as he could from his back injuries, and he went right back to work. But something was different. You see, before his accident, this individual was on the fast track to success. He was a senior director that had everything going for him. He was a senior director at an extremely young age. But now something was different. He went back to work, and he started getting feedback from everyone around him, saying that he was a different person. He seemed to be very anxious, snapped very quickly. It was hard for him to finish projects that he started. This was nothing like the person that they knew. So what happened next is his management did what might be the most important thing for him that they ever could. They told him, we want you to take the time to recover. We want you to go on disability because that's what's best for you. So that's what he did. Now, when he went to recover, there was a lot that he had to recover from. First of all, he couldn't even get behind the wheel of a car because every time he did, he saw the image of a dump truck in his mind. That's post-traumatic stress. He had post-concussion syndrome. He developed OCD. He had to get over his back injuries, his spinal injuries. He had to deal with his court case. He had to deal with legal fees. He had to deal with transportation because he couldn't drive. But with all that being said, he was a senior director at Johnson & Johnson that had all the resources available to him in the world. He had some of the best insurance, some of the best support network. And 3 years later, he came back to work. 3 years. This is someone who has a degree in health policy excellence, that knows how to access health care, that knows what he needs to do to get better. But it took him, a senior director, 3 years. And what he told me next was it's not about him. In his path to recovery, he came across countless people, many of them veterans, who were stuck in the system. They didn't know what type of care they needed. They didn't know how to access the care. They didn't know how they were going to pay for it. So he asked me a question. He said, what is Johnson & Johnson doing to help these people? You know, I didn't know at the time, so I told him, you know, I'll look into it. It's a pretty big question. So later that night, I couldn't sleep. So I booted up my laptop and I started typing an email to him. I told him that he lit a fire within me. I told him that with the greatest healthcare company in the world behind us, and with the network that I've been able to develop at the Veterans Leadership Council, that maybe, just maybe, we can make this happen. So what I did next is I leveraged our network. And I got support from 3 amazing J&J leaders in Courtney Billington, Husseini Manji, and Michelle Goodrich. They said that they would sponsor this project. So what I did next is what I think most good J&J leaders do, at least I think so, is I talked to some consultants and I asked them if they would make me some really nice PowerPoint slides. But it wasn't, all jokes aside, it wasn't about the slides themselves. It's about what went into the slides. We asked this group of consultants to start going out into the communities and talk to the patients, talk to the families, talk to the nonprofit organizations that are helping them, that are helping the traumatic brain injury patients today, and find out where the gaps are, find out where the real gaps are. And what we learned next was alarming. First, as of 2015, there has been no drug or medical device approved by the FDA for the treatment of traumatic brain injury. Nothing. We also learned that today, TBI patients seek care through 3 primary channels. 1, nonprofit organizations that help with education and advocate for change to policies. 2, through emergency rooms. Now, I told you earlier that 87% of those people that are checked into emergency rooms leave within 24 hours without a plan. And 3rd, for the moderate to severe traumatic brain injuries, there are many great rehab clinics across the country and across the world that are doing a great job to bring these people back to normal. But what about that 14.4 million people, those mild to moderate traumatic brain injuries, the unidentified cases? What about them? Take a second to imagine that you wake up in the hospital and you leave the hospital and you need to coordinate your own recovery. You need to deal with all these different things I'm talking about in order to recover. You need to deal with the psychological recovery, the physical recovery, the insurance, the lawyers, the legal fees, the disability, the getting back to work, speech therapy, so on and so forth, so many things. But you have a lack of executive function because you experienced a traumatic brain injury. How could you possibly do this? You might be saying to yourself, well, I have a spouse that will help me out, or a family that will help me out with that. Okay, fair enough. One alarming statistic that I came across is that in one study, it showed that up to 80% of TBI patients experience a divorce. 80%. So maybe that support system isn't there for them. So, listen, I'm not a scientist. I'm not a doctor. But I am a IT solution architect, and I've built many platforms across J&J that thousands of you are probably using today. So what my plan is to build a virtual care coordination platform for traumatic brain injury patients. This platform will be broken down into 4 key areas. First, patient engagement. Imagine you wake up in the hospital, you're handed a tablet. You fill out a few simple questions, and you're brought into our system. Once you're in our system, you could see everything you need to get better. You can see all the different healthcare providers around you in your local area. You can journal your thoughts and ideas and communicate, and you can start to understand what it takes to actually get better. Second, care planning. Now, this is what happens on the back end of the platform. There's going to be risk stratification processes. They're going to have to connect to electronic medical records and all kinds of, fun IT geeky stuff. But I don't think that everything can be automated. That's right, I'm an IT guy, and I say I don't think everything can be automated. I think we need a human being, a nurse care coordinator that's going to be able to talk to each patient and build an individualized care path for the recovery. This nurse care coordinator is going to ask them their spiritual needs. They're going to ask them their likes, their dislikes, their fears, what normal means to them. I don't think normal means the same thing to anyone over here that it means to anyone over here. We all have a different idea of what normal means. So that's the third area, care planning. Next, we have performance monitoring and reporting. This area, I think, is probably the most important to Johnson & Johnson in the long term, but the most important to the patient in the short term, and here's why. Today, J&J, we have many areas that we're looking at, like mood disorders, dementia, major depression. Imagine all of the data that we can start collecting, all the data that we can collect for traumatic brain injury. Well, guess what? Those are outcomes of TBIs. So we can start collecting data that's going to improve our drugs today. For the patient, we can allow for real-time monitoring. Now, if you experience a traumatic brain injury, or someone you know, it's important to realize that they're at a much higher rate or probability to commit suicide. So what if we can tie in with their social networks? What if we can tie in with avatars, like previous speakers talked about? What if we can do all things like that to understand, are they going to commit suicide soon? What if we can predict that? I think we can. What if we can use IBM Watson, as we heard earlier? Care delivery. This is probably the most difficult area for us to put together. Today, your psychologist isn't necessarily talking to your neurologist. Everyone's acting in silos. So we need to build a network of care providers for these patients that are going to be able to talk to each other. We also need to enable telemedicine. I challenge all of you to say to yourselves right now, if J&J isn't in the field of care coordination and telemedicine in 20 years, will we be like these steel stacks? Maybe. So I took this idea, and I started to share it across the networks. And I took this idea, I took the 90-plus slides that these consultants put together for me that went over things like, the specific type of services these patients need, if they're getting reimbursed for them today, and if not, when is that going to happen, and all kinds of data. And the feedback I got from leaders across Johnson & Johnson was very similar, and it could be grouped into 3 different categories. 1, great idea. We're not a technology company. 2, we're not a healthcare provider. 3, traumatic brain injury is not one of our disease area strongholds. Okay, so I spent a couple months hearing the same feedback, and then I realized, okay, maybe I need to pause. Maybe I need to take a step back. We can't do this alone. But we can do it if we form a coalition of companies. If we bring together insurance companies, if we bring together healthcare providers, if we bring together patients and nonprofits and hospitals, even maybe some competitors. What if we all came together? Or better yet, what if J&J led this coalition to build a platform like this? Because I honestly believe that where J&J goes, others will follow. I do. So the feedback I got after this was incredible. All of a sudden, everyone was saying, this is a great idea, let's make it happen. And I'm proud to say that as of last month, I had the opportunity to sit in the office of Alex Gorski. Now, 6 years ago, I was a security guard making $10 an hour at Johnson & Johnson Healthcare Systems. Last month, I sat in the office of our CEO, and he didn't tell me no. He didn't tell me no. But what he did tell me is that we need to find a strategic place that this fits at Johnson & Johnson. We need to find a home. So what I did next, as soon as I left the office, is I called my friend that was hit by the dump truck. And he's no longer with J&J today, but he's doing good. And he said to me, what he said to me next was a little surprising. He said, that's great, and I'm so happy that, we've made this progress, but it's been 1.5 years, and we haven't helped one single patient yet. Not one. So I stand here today in front of all of you, asking for your help. Can you help me find a home for this? Can you help me save lives? Thank you.